Onychocryptosis, or ingrown toenail, is a condition that occurs when the edge of the nail grows into the skin, causing pain, redness, and inflammation. This pathology mostly affects the big toe but can occur in any of them. There are two types of ingrown toenail: side, which is the most common; previous, that appears when the nail incarnates forward. There are several causes for ingrown toenails. For example, ill-fitting shoes, constant and repetitive pressure on the toe, deformed nails, frequent long-distance walking, trauma, and improper nail trimming. To treat this problem, the doctor will examine the patient's nail and ask several questions about their symptoms. Medical tests or X-rays are usually not needed. Depending on the state in which the nail is found, the doctor can opt for a conservative treatment instead of a surgical intervention. In conservative treatment, a smooth cut is normally made with a scalpel on the ingrown nail, and then tensors are applied to educate and correct the shape of the nail so that it corrects its course and avoids resorting to surgery. For the surgical intervention, the doctor will inject an anesthetic into the base of the affected toe so that the patient does not feel pain during the intervention. After this, the patient's finger will be wrapped for 10 to 15 minutes with alcohol-soaked gauze, after which time more anesthesia is applied to the fingertip and a smaller portion of the proximal nail fold on the side to be operated on. After that, the entire area will be washed with chlorhexidine, an antiseptic with bactericidal action. Subsequently, all the foam will be removed from the surface with saline and the area will be disinfected once again, but this time with iodine. Once the area is covered with the sterile field, the surgeon will proceed to make a longitudinal cut in the nail with dissecting scissors, leaving the nail barely visible between the affected nail fold and the cut. With the help of an instrument called a gouge, the doctor will finish cutting the entire nail matrix. And later, with another tool called a straight halsted forceps, holding the fragment of the nail to rotate the ingrown part and then pull it until it is completely removed. Once this was done, the doctor will carry out a detailed inspection of the intervened area to make sure that no nail remains were left. Once verified, the specialist will clean the area with saline solution and proceed to cauterize the intervened tissues. Finally, the affected area will be covered with antibiotic cream. Then, the finger will be wrapped with a compression bandage, which will be removed until the doctor indicates it. During the next 48 hours, the patient will be recommended to apply a cold pack, rest, antibiotic cream at least 3 times a day, as well as the use of analgesics. It is important that this intervention is carried out only by experts, so please, if you have this problem, before undergoing any procedure, verify that your doctor is certified. Your health and that of your loved ones is the most important thing.